Maria could get a vacation every once in a while. She's on vacation. But she, of course, left us with treats before she left. So there's homemade banana bread by Maria, some nuts and water. So please eat that. I know I can't get her to stop working. I tried. So let's start with the introductions, and then we'll go over community rules, and then we'll get into our presentation. So my name is Jennifer McDonald. I'm the Gateway Operations Officer for the city.
I'm Jenny Metzler. I know some of you. It's good to see you again. I'm the Chief Executive Officer of Albuquerque Healthcare for the Homeless, and we've been working with the medical rescue.
Janet Simon from Parkland Hills Neighborhood Association. Donna Strong, Parkland Hills resident.
Wally Book, Parkland Hills resident.
Sean Comstock, Parkland Hills, and Parkland Village.
Edward Lopez, Parkland Hills.
Eva Blaylock, currently our First Base Public Affairs and Silver Hill Neighborhood Association president.
Hi, good evening, Bud Verdi. I'm with Kirkland Air Force Base. I think Colonel Power's been here. I'm Colonel Power's Executive Director.
Hey, lady.
Are
you, sir?
Our association.
Sandra Perea, President of Alder Homestead Neighborhood Association and Vice President of the District 6 Coach.
I'm Danielle Smith. I'm a forensic case manager in the behavioral health unit with Bernalillo County Sheriff's Office. I also sit on the board for the South San Pedro Neighborhood Association.
I'm Robert Outman. I'm the Gateway Women's Shelter Program Director and the Medical Rescue Director.
Chloe Lusso, I am the Gateway Systems Analyst.
Mike Kruchowski, live north of Mark Twain neighborhood, just a community member.
Okay, great. Steve, can we have you start in the back?
Steve Sacco, a business owner and board member of Elder Homestead.
Good evening, Pete Mileto, District 6.
I'm Sean Hagan. I'm a lieutenant in the Southeast Area Command. I'm in charge of Watch 3 with Switch.
Laura Keenan, the Senior Crime Prevention Specialist with APD. Okay, great. Oh, sorry. Thank you.
Natalie Vargas, co-chair for South San Pedro Neighborhood Association.
Daniel Vargas, South San Pedro, President. James Shanley, Mark Twain.
Okay, I'm gonna start the sign-in sheets around. Okay, so just a reminder about our community roles. Remember that we are going to participate fully. So that means participate in the conversation, inside conversation. Make sure that you are respectful to the listener and the speaker. And as Maria's favorite saying goes, be hard on the issues but soft on the people. And so we're going to stay on topic and respect agenda and time constraints. We will end on time. Okay. I am going to turn it over to Jenny. We asked Jenny to come in. As most of you know, I've only been in the city a short amount of time, 10 months right now. So when I came on board, Jenny has been such a great, helpful partner for just me personally as a brand new employee in this position. She does amazing things for our community. So we were very happy when she said yes to come speak. So.
One conversation, please.
So we're going to turn the time over to her, and then I don't know if you want questions in the middle of your question or at the end, or however you want to do it.
I'm happy to take questions as we go, and I don't need to talk too much. I know some of you have actually toured the medical rescue. You know the medical rescue well, so it's good to meet you. Jump in, however. But I think.
Is there more agendas?
I don't need that.
That one right there.
Okay, thank you.
It's great. So, my one caveat, Janet's known me for a really long time, and she looked at me and said, I am not usually in meetings in sort of such a physical mess, but I was at my doctor's office. The older I get, the longer I spend time with my doctor. So I'm dilated. I don't always look like this, and I'm sure you don't always look, so we're looking at each other, and it's probably all a little odd, but if you look at her, why are her eyes so dilated, it has nothing to do with any need for services or anything. Just haven't seen that. So I'll sit down in a minute, and I'd love a conversation. I'm Jenny Metzler. I'm the Chief Executive Officer of Albuquerque Healthcare for the Homeless. I know some of you, I know many of you know our organization very, very, very well, and have supported over the years. I live right by Hyder Park, between Hyder and Burton and Carlisle. I love my little neighborhood. We're homeowners there. I've owned homes there for a very long time, and so I've also been able to participate in some of your neighborhood association meetings, not recently, because if it's not right by my house, I walk my dog in your neighborhood. I love this area. So I always like to introduce myself with that as well. Normally we're based downtown at First and Mountain, but our outreach teams work all over Bernalillo County. That's our service area. And so one of our mantras with the teams is, we live and work in neighborhoods. We're neighbors. We have to be good neighbors. And that means not shaking our finger at people and not telling people how it should be, because we all live somewhere. And so from our First and Mountain campus, all throughout our service area, all of our teams, we work with APD, we work with neighbors. I love visiting neighborhood associations because I want to, I'd rather not assume that I know what any of you think as formal associations. I'd rather not have you sit and steam at me for something I say that you don't buy, or that we disagree on. Like, that's okay. So I encourage all of our teams to get out as well. So I jumped at this opportunity to come over here and talk about medical respite, which is very exciting. So how many of you did the tour? I know several months back, I think there was a tour of medical respite. Okay, so you've been talking about this, you have some sense. We are so excited to be open, working with our collaborative partners. This has been a really long time coming. I have just a few handouts and we can get more. I know some people like paper, others don't. We have a prospectus, we have tons of information. We have clinical criteria for the partners. We have some standard operating procedures, everything around how to do this collaboration in this space for this program that we've just launched. The timeline goes all the way back to 2017. Were any of you at the open house when it launched? Yes, this was a while ago. It was packed. It was a blur. We had a big timeline up, and I just thought it was really impressive because people often say nonprofits or the city or the community or for-profit healthcare all need to collaborate. We need to collaborate better. We need to demonstrate your outcomes. We knew that there were people who did not need to be in hospitals at great cost to the system, to first responders, to the healthcare system, who maybe were insured, maybe had Medicaid. They didn't have homes. So when the cities, I'm sure many of you have been in a hospital or had a loved one in the hospital, someone you cared about, and Friday afternoon at 4:30, they need those beds. So what happens? Anyone who's had hospital or worked in hospitals, or they start disinviting you. Time to discharge, we're ready to discharge. I myself have been there, and I don't usually talk about my personal experiences much, but in 1998, I was just coming up on an anniversary for this, but in 1998, a long time ago, I was working with Albuquerque Healthcare for the Homeless. I owned a house at Santa Clara and Girard at the Fuller stop. Driving into work, woman ran a red light, T-boned me at Girard and Cole, and I don't remember hardly a thing after that. I was in the ICU for 9 days. Wow. I had 5 pelvic fractures. Prognosis was always good. I was bleeding out, so they opened me up. I was in that hospital, like I said, in the ICU for 9 days, and then they didn't know what to do with me. They tried to discharge me, and I said, all I need is the PTs to show me how to get up the stairs to my house and in and out of my car. I don't need intensive rehab for the next 3 months. My prognosis is good. I'm progressing really well. I'm good on my walker. I have extended family. I have a home that I own. I have great neighbors who'll do the gardening and walk the dog. I have health insurance. I have a supportive employer. Like, you could go down the list of all the things that I had for my safety net that kept me from landing on the street, number one. But I also will never forget when they showed up with a wheelchair and said, you're going to rehab for 3 months. Who made that decision? And why would, that's not a good use of resources. So what I love about this medical respite is this is a really collaborative, public-private, long in the making project that addresses a gap in the community, and we didn't start fighting about it, shaking our fingers at who, honestly, and Kate Becker, we're here today, the CEO of UNMH. I've said this to her before, the hospitals get accused of, get sued for are often stuck in a position of discharging people to the streets or to shelters because they don't have anywhere else to go recuperate, where I was able to do that, others might be able to do that. And, sometimes it's kind of dumping. I mean, out of frustration or whatever. I mean, that's one way of looking at it and what we could call it. We didn't approach it that way. Our organization knew about this emerging model nationally, medical respite. And rather than going to the hospitals and saying, we're going to sue you to get a medical respite, which a lot of the medical respites around the country did. That's how they started. We thought, well, then, you do that, then you always have to, if you win, then you have to enforce it, then you have to. We thought, what if we just went and said, everybody in this room cares and doesn't want to see people on the streets in their gowns with, their IVs maybe, or their bandages, dirty bandages, no shoes, like whatever that, their hospital, no one wants to see that, so what can we do about it? Here's a model that we think will make a difference. So what's it look like here in Albuquerque? So we started in 2017 talking about that. The city was at the table from the beginning, heading home with different leadership. Although Connie Chavez, the CEO of Heading Home, was at Barrett Foundation at the time, so she was at the table there. So you're saying for the shelters with dedicated beds, like what's a high, we don't want to get rid of that, but what's the higher level acuity need and what's the outcome? And when we started talking nationally about medical respite as exit to housing, we don't want to have people come to medical respite on average for 45 days. They could be shorter, it could be longer, and then discharge them back to the shelters or the streets, which is what was happening with some of the dedicated beds here in Albuquerque. But what could we do? So the city not only stepped up, built this beautiful space, but also allocated some general fund vouchers, housing vouchers. So if you're in medical respite, and I hear we have 11 people in respite right now,
Yes.
and we have 2 that are in the discharge process to vouchers already?
I think we've got
Not
3 of
discharge.
them. Yeah,
Yeah.
they're getting vouchers and then they're going to be able to look for places to live, but they are beyond excited.
Yeah, so all that support is there, and if you just need a couple weeks, or if you need 3 months, or whatever that is, then, we're not gonna shove you out and then just to get really sick, and that's the reality of homelessness. So we're really excited it's real. We're working with the city has provided space, those housing vouchers, which are really different than a lot of the projects around the country. So we're excited to test that and see how that works, so that we can then advocate that that's the whole model, and we won't be seeing people again. We have Heading Home doing the operation. First Nations, whom I'm sure you all know, is our sister federally qualified health center that serves the homeless population as well. So they, in Albuquerque Healthcare for the Homeless, are doing the clinical care. They integrated teams, but that means housing navigators, that means community health workers, community support workers, behavioral health people if we need it. We can call in occupational therapy, PT, there's space up there for that, which you all saw. It's really very comprehensive, so someone can recuperate as if they were in their own home, but they just don't have one. So, to name all the partners, UNMH, City of Albuquerque, Albuquerque Healthcare for the Homeless, First Nations, and Heading Home. Another really critical partner, and something we were able to do with this model because we did a really good prospectus and we really researched it, and we did a lot of technical assistance here. We traveled to Phoenix, we brought people in for the whole learning group together. We got state legislative money to design an evaluation. So that was designed before we started. We didn't start and then say, oh, we're going to have to evaluate this for the funders. We said we need an evaluation plan so that we can justify that we're good stewards of this money and the impact for the people who are in the program and the return on investment for all the collaborators and everything that's come in. So we have an evaluation plan designed. Everybody's trained on the data. We're all agreed. We have data sharing agreements. We'll measure the cost, the health income impact, housing outcomes and impacts. There are a whole bunch of factors in that evaluation. I'd be happy to share any of that at any point. But I think the main point of this is we're excited about it. We believe in it. It's evidence-based. It's a great partnership. It's a good use of resources. And we're going to hold ourselves accountable to all those promises. So the other thing is that there is a Medicaid pilot. We'll see what happens with Medicaid with the change in administration. But we are in the state's Medicaid plan, for those of you who are in healthcare, the 1115 waiver, where a named medical respite is a named pilot 5-year pilot project. And we will get some enhanced Medicaid billing for some of the costs of beds, linens, things, nursing care, things right now that are not billable to Medicaid that will be enhanced in this model. And they'll have their own evaluation at the state.
At this facility?
At this is the pilot, yeah. We're named pilot. Now, we'll see what happens to Medicaid. But the word that we have from some of our national partners right now is that there might not be new opportunities like this for Medicaid pilots and innovations, but they're not at this point intending to rescind anything that's already been approved because they're, it's an agreement with the states. So So I think that's it. Would you add anything about the program? Or?
I would just say it's been fantastic working with the city, working with Healthcare for the Homeless, and just some of the ideas that, you know, we have 38 standard beds. We have a capacity for an overflow of 12 because medical, you know, we don't know how long it's going to take someone to heal. We also, for those who deal with housing, you have to go through an inspection and, you know, you might be healed, but still have 2 weeks before you get your keys. We can keep the people in what we call overflow for 2 weeks, 4 weeks, so we're not sending them healthy out onto the streets to get lost. Because especially when I was an intake coordinator, people are turning ghosts. You'll never find them again. For good or bad, you know, they might be okay, they might not be. The fact that we can keep them in-house until the housing is there and we can go from us to their place, I think it's a fantastic idea. The city came up with that, I was told, and I love that. And it's been painless. The issues that we've had have been with the hospitals telling us, oh, so-and-so will be there Monday, and they show up Wednesday. And at 5 p.m. when we've told them not to. But otherwise, it's been a wonderful, wonderful opportunity. It's exciting. We're going slowly, 10 at first, and we've just begun our second month, so we're going up to a capacity of 20. But I could not be more excited. For those who've seen the facility, it's beautiful. Those who haven't, it's beautiful.
There are people in it now, so we can.
Yes, yeah. It's just stunning. So thank you for.
Oh, to all the partners, it's been, the city is also contracting with Heading Home, so that's another huge contribution from the city. Heading Home bringing their expertise and teams. It's just, you know, First Nations and Albuquerque Healthcare for the Homeless are not getting paid. We're reorienting the resources we already have as health centers to this really high impact thing. Because otherwise, I mean, we could go out and do outreach and see people and see people and see people, and they go to the hospital, and they go to jail, and they are back on the streets. You all know, and then, or we could really focus our resources on this and test it. Test the concept, fidelity of the model. So I think one of the biggest things, I'll let all the I don't do operations. I'll let our operations teams work out all those kinks and the referrals, but that's also the beauty of it, is that we're figuring out, wait, this is why sometimes these referrals don't work. Because maybe they're not appropriate, or maybe there wasn't good communication, or maybe we thought we expected on this day and they didn't come. So this is really also sort of a laboratory for us to work out all these systems. Relationships are hard and people often give up on them. And then I'm going to say, as a longtime nonprofit CEO, what we do as nonprofits is we empire build. And we just say, oh, well, that was too hard to work with them, so we're just going to build this or do that, and we'll never be big enough. We have to work together to really have an impact.
So the people that come in for respite are mostly coming from a hospital?
They're all coming from only University Hospital right now.
Only from the University Hospital. And so then they stay, they get better. How do they qualify for a voucher, or do they all just qualify for a voucher?
It's a really great question, because we're looking at vouchers and the complexity of vouchers right now. These are general fund dollars from the city, so we don't have to use HUD's requirements. We don't have to document a disability. So medical respite is a medical program. That's the central. Doesn't mean people don't come. I mean, any of us go in the hospital. We might still have behavioral health or other issues, but people come in primarily because of a medical need for recuperation. If they get through that inclusion criteria, the partners, and we have a nurse who's working on those, determining that, and working with point people at University Hospital to figure that out. You know, do they fit all the inclusion criteria? If someone can't at all take care of themselves, this is not the program for them. We might build that later, or they should be in a nursing facility. But if someone can't take care of their own meds,
Right,
then,
so they're in respite though.
But as soon as they get in respite, they're eligible for that voucher.
Okay, so you're not going to take them in respite if they're not able to meet those criteria? Is that what
There
you're
are
saying?
certain ones for the level of care we're providing in this respite. And we did a needs assessment pre-COVID in 2017. I think it was when we published it and then we updated it. And we thought that there was, at minimum, on any given night, 50 people who could benefit from this. I'm sure it's much larger than that, especially now. But we had to say, all right, so what can we best do? You know, we're not doing hospice here, but we learned through that needs assessment and this whole process that there's a need for hospice for people who are unhoused. We're doing an aging study right now. I can't wait to come back and talk about the aging study with the National Partner Community Solutions and their public health group, and we're just getting ready to draft that so that we can share it and discuss with people. But there are exponential increases. I mean, it makes sense. I'm going to be 62 next week. On the tail end of the boomers, here we come, here we are. I mean, it's just demographically, it's huge, and so we're seeing the increases of people becoming homeless later in life, and people whose safety net is falling apart, just sheer demographic volume. There are more people, and more of them are experiencing homelessness. So we want to deal with aging, and with that comes hospice. You know, there's being sick and dying, and there's really, there's no place for that. But when we thought about it, we thought we need to take something really discreet and be able to really do it right, measure it till it's ready to scale, and then that'll be the next phase, is to look at some of these other things.
Okay, thank you.
But yeah, if you get into respite, you're eligible for that medical respite voucher. Once we're fully up, all 38 of those people, or however many up to 50 with overflow, they might not need these vouchers, because they might be able to get back to work, and then through their wages can pay for housing, and they're healthier again, or might have a permanent supported housing voucher, or get to Section 8, or if someone's a veteran, then we can connect them with the VA. Maybe they get a VASH voucher, a housing voucher for the VA. So our housing navigators will look at everything from, private market, self-pay tenants, all the way to vouchers. And then the ones who have none of that and most need those medical respite vouchers, they're automatically eligible. It's a huge resource.
If I understood you talking around the issue correctly, and feel free to say I don't know the answer, or I'm sorry, I'm not going to go there.
Sure.
There's a concern that funding may be eliminated for this, as it has been, like with Department of Agriculture and USAID type things. Are you? How much have you? Is there a contingency plan for federal funding drops out?
Our organization is a federally qualified health center. We're doing 2 3-hour sessions with our executive team every week since the inauguration, to just keep track of all of it, see what's going to stick. They're definitely, and we'll see. I think that there will be either cuts, for sure. We don't know how big, we don't know where, we're still looking at that, for anything that's federally funded. I think that Medicaid is at risk, it's always been at risk. And so what I think it will be is a reworking, a reduction, a cut, or increased, and I will editorialize, because I can talk around or I can talk right at, but but as a healthcare advocate and CEO of an organization that provides healthcare to vulnerable populations, I think that there will be, burdensome is a euphemism for the kinds of requirements that they will attach. So if the funding doesn't go away or isn't reduced significantly, then the burden of having that money, audits, increased compliance requirements attached to our grants, we're already seeing that with some high money. None of it right now is insurmountable. And the thing about us and First Nations and our federal funding is that we are in statute, we're in federal statute. So it's harder to tinker with what's in statute than it is with what's in this discretionary budgets for Congress. So if you look at some of the patterns there, does that make sense? Is that talking around there? So yes, we're doing contingency.
I'm a little bit skeptical about the statutes providing much protection in these.
I'm not saying that it's providing protection, but it's delaying where they're going first.
Okay.
For federally qualified health centers. And this comes from the best attorneys in DC on federally qualified health centers. I could be so proven wrong tomorrow. We just don't know. I know, and I appreciate that. Thank you. But we're trying to be really realistic and then just keep going. But we do have contingencies built in. Our organization has always had a business model that is, we have 40 to 50 funding streams at any given time. So we don't rely only on federal funding, only on city funding, only on county or state funding, and then we have a very large, we raise over like $1.5 million now in philanthropic funds. And so we've diversified that as our business model so that we can take hits without, having a disaster in 2 weeks. I have a finance committee meeting tomorrow of our board of directors, and they would just grill me for this kind of optimism, maybe, because it's their job. It's their job to think about risk. So it's on our minds all the time. But we are committed to this, and as long as our organization is in existence, we will continue to do, because we're also very strategic. So once we set up, this has been a major strategic initiative of ours. for probably 7 or 8 years in our business plan, that we would allocate resources to this. So as long as we're around, we'll be doing this. Yeah, did you have a question?
I do. Senator Kennedy has cut 20,000 jobs out of the National Health Department. I mean,
Secretary.
You can see where it's going. The mayor had a very strongly focused approach to solving some of the funding problems. He met with the community and kind of laid things out.
Yeah.
And he
No more
did
free
indicate
transit?
that we're going to have cuts.
Yeah.
And that in fact, some programs could be eliminated. It
Yeah.
just depends how this unpredictable president attempts to pursue cost care efficiency. The governor has also talked about a special session to secure funding for Medicaid. I mean, I think we have folks on it, but I think this committee and everybody you know ought to be talking to legislative representatives in terms of concerns you might have and where you'd like to see the money spent.
I think that's a good point. I don't know if Jen wants to say anything about that from a city perspective.
No, I mean, I think we're taking the same approach that Jenny and her team is, at least within our department, is how do we shore up that we're not relying on just federal funding, and how do we seek other funding sources to make sure that we can stay whole. I mean, there's been some scrambling about, we have some employees that are on federal grants, and how do we scramble and see funding so that we can keep our department whole. I think there's a worry. I tried not to be a person that pre-worries, but at the same time, we have to strategize and think about how we're going to do this if, we want to help as many homeless as we can to get them in a safe and healthy position. But at the same time, if the cuts are coming faster than we can strategize around that, then I worry about what's going to happen for our community. I think, back to Jenny's point early on, the amount of community partners and other governments, county, state, that we're going to have to rely on to make sure that we can work together is, it's becoming clear to me that what we've been doing is great. It's going to have to become stronger for us to be able to keep at the work. So, yeah.
There is a good, how many more days does the governor have to sign anything? Who's tracking that? Down to 3 or 4?
Yeah, a couple more days.
Yeah, so there's a good chunk of housing money in there. I do think, I don't know if she'll do a special session on healthcare, there's several special sessions, and could brought our policy person along. But I do think that, I do feel confident that it was kind of like with the pandemic, however people felt about it. We had a lot of public health, we have a lot of scientists in New Mexico, a lot of public health people in New Mexico. They were thinking about, the what ifs, like what ifs and what would we do for New Mexico, all this federal money that's coming in. I mean, I heard some of those conversations, and I think right now I feel confident that, our state is, our state leaders, and we know they don't all get along all the time. But I think they're thinking, so how are we going to shore up? What can we do with the resources we have? Not just financial resources, all the resources in New Mexico, from an assets perspective, and how do we shore up, take care of the Mexicans, and there's a lot in there about health and housing. This last session just exhausted everyone. Was anybody up there? Has anybody worked this session? I'm not talking to any of my team members who have been up there until they get 2 weeks.
Decompressed.
Yeah, I'm not going to ask anything of you.
Right.
So, and did you do something?
You had asked if anybody had attended the open house, and for those of you who have this, if you follow that link up there, somewhere down here, I have a copy of it on YouTube.
Oh, great.
And I'm sure that there's another copy someplace on the city's.
Yeah.
But this one's an easy one.
Nice, that's great. And our website as well, our comms team, I have a bunch of materials I'm supposed to hand out, and I always forget because I start talking, but I do have our most recent annual report. We're doing another one, so if anybody still takes hard copy things, I have some collateral here about our organization. And a few fact sheets on just real basic stuff on information on medical respite. But I'm happy to provide more email. I can send it to you guys, the distribution, anything that would be interesting about anything. Other comments, questions, or?
I will just say, it's medical respite is one of the ways. There are a multitude of reasons why someone could be homeless. Medical respite is just one of the ways that we're trying to focus and target on a cause of homelessness. Robert always seems to be dealing, of course, with data. So Robert will always come to these meetings with data, but I just want to give you a personal perspective of what we're seeing. We've been open for a month.
24th, yeah, last month.
We've been open for a month. We did it on a scale opening. We opened 10 beds at a time. We 11, 13, 12. Do we have 12 today?
We have 12 today.
We have 12 today. As we talk about partnering across different divisions of the city, across our community partners as well. Last week we got a call from APD's victim liaison and ACS reaching out to us about respite. We had an incident in the city where a mom and daughter, and when I say mom and daughter, they're both adults. We had a mom and daughter who were living in their car, were the victims of a carjacking where the mother was shot. Mother went to hospital, and now they've lost their home, their car, because now the vehicle's evidence. And so we got an emergency call from APD, Victim Liaison, and ACS wanting to know what we had available. Did we have room at Gateway Women's? Could we get the mom into respite as soon as she was out of surgery so that they weren't literally putting them on the street? And so these are the stories that we're seeing. These are the things that are coming in. When Ginny talks about the safety net for her surgery, I will tell you every day I think I'm a little bit closer to understanding the privileges I carry in the world, and every single day I'm smacked down and not understanding just the safety nets that I don't visibly see and understand, and how precariously housed most of our community is. It only takes one incident of a job loss, a sickness, an incident of crime, fraud, to where someone was housed and is now unhoused. And so I really do appreciate the partnership that Jenny's team brings and that Robert's team brings in to make sure that we have spaces that we can offer people safety, security, and a community support where they're not feeling like the community's turning their back on them. So I just really appreciate that I can pick up the phone and call Robert and be like, oh my God, hey, you're gonna get this intake, make sure you're looking out for it. So
Yeah.
Thank you.
That's the team is doing. Robert and Gail is our nurse on the team. Just every single day, people have been waiting for this for years. Other hospital systems are calling. I think one of the biggest stressors is saying no. Someone doesn't fit because people have such great need, and so just saying, please, just let us have fidelity of this model, test it, and then we can scale it because we could have these all across the city at some point. But for right now, you guys are doing the hard work.
Thank you. And it's been, like I said, super satisfying, and just seeing that the facility blossom. It's just wonderful. It's exciting going in every morning.
Does anyone have any more questions for Ginny? Or you talked mostly about respite, but your team does a whole lot of other work besides respite. So did you have a question first?
I do. You say you have 50 beds available here. How many? And you just said you'd like to have these all over the city.
Yeah.
How many do you think you need?
I think we would have to do an updated needs assessment before I would speak to that.
You must have a general idea.
So we have one hospital that filled out to 13 in just a month, they were able to make that many referrals. I'm sure that they'll get up to, with the overflow, it's 50. What is it? The overflow isn't ideal, but there's so much demand that, so up to 50. You know, how many other hospital systems are there? You know, at one point we were saying it's 300 over the course of a year, I think, if people go on the average stay of about 30 to 45, but there'll be, you know, more or less. I don't know, I could have 10 more of these. You know, I wouldn't see them as being separate things if they could be in larger institutions or hospital or healthcare systems. At some point, you know, I would hope we, you know, the intervention of housing someone because they come through one of our shelters or through our organization or through medical respite, at some point, if we can keep people housed, that becomes prevention. It becomes prevention of homelessness. So, you know, over time, we think a program like this, if we're truly exiting people to homelessness successfully in the model as intended, then at some point it would reduce the number of people because people weren't just cycling through. So I don't really have a good answer for you. We're so in like a data space right now that, but we really do, we want to get this one right.
Do we have an estimated PID count yet?
Yeah.
That won't be released until June 5.
For just the most recent one, but there were some numbers analysis that was just released. I think we're still, Albuquerque's still up there as, anyone else? Fastest growing homelessness in the country. We're right up there. We're right up there.
Why do you think that is?
I think it's lack of affordable housing. Oh, can I pitch something?
Yes.
Okay. So, do you all know about HomeWise? It's another housing organization, really excellent organization led by Mike Lofton and his team. They did a livability series in Santa Fe last year. Yeah, we'll get you this up. And they brought in national speakers, like wonky people who are county managers and land use planners, and they brought Greg Colburn, who wrote the book Homelessness is a Housing Issue. If you've read it or heard his YouTube lectures or whatever. So they brought him to Santa Fe, and then what they do is they engage city councilors, electeds, community people. They have this conversation. So they give some good information about solutions around the country, and then they have conversations. So it's a very community engaging approach to these issues. Most of that housing, but by definition, of homelessness as well. And so they just kicked it off in Albuquerque, and they're having 4 sessions, and they're bringing Greg Colburn again. I think it's April 10th. Yeah, thanks. And then they have 2 more after that. And it's just a really good series. It's just you can go, you can listen, and then leave. It's free, but you do have to register. It's down at the National Hispanic Cultural Center. And it's just very thought-provoking. So you said if you have 2 takeaways from each speaker, why can't we do that here? Well, maybe we can do that here. I think it's all about engaging people in solutions with a little bit of perspective and then coming together and talking about it. So I would highly encourage that. But it's all, Greg Colburn. If you haven't read anything or seen anything or listened to anything he's done, he's going to be coming to Albuquerque, and he's got really good data. And actually, would bust open things I've probably been saying for years. Oh, it's about this and it's about this. His book just kind of blows it open. So he'll be here, and there'll be some question and answer panels and access to him. Yes.
2 questions, one for each of you. For you, Jenny, am I understanding correctly that the level of care provided at medical respite might be similar to that in a long-term care facility, but the difference is insurance or no insurance? And Jennifer, what's the end of the story? Is the daughter able to be with the mom?
Yeah, so I'm sorry I didn't give you the ending. Yeah, the mother is at medical respite and the daughter is at women's labor. So we're taking care of them, and the goal is to exit them to housing.
That was important to address first. It's a really good question. We are obliged, so First Nations and Albuquerque Healthcare for the Homeless as federally qualified health centers, we are required to serve anyone who is eligible for our services regardless of ability to pay. So we serve the insured. We will take Medicaid, you don't need Medicaid. Medicaid's a nice infusion to be able to sustain the services. Medicaid, most importantly, Medicaid expansion in New Mexico, if that is ever at risk, has been tremendous for the people who we serve because we don't do everything. So if they can go to a specialist for their child, for speech pathology that we don't provide, so first and foremost, it expands opportunities and resources. Coverage does. When we don't have coverage, we might not go get care. But it also, it infuses money into the services and what we're trying to do. But medical respite takes uninsured people with Medicaid.
I should have thrown in that, that's not where that
Okay.
comes from.
So
The
then
level of
we
care.
clarify? No.
The level of care, is it analogous?
Yes.
Do you want to talk about ADLs and how respite is different from skilled nursing?
Yeah, so there are a couple of things. So it's not a skilled nurse, medical respite is an animal that doesn't really exist anywhere. It's post-acute care, hospital people would call that. It's not a nursing facility level. It's not assisted living. It's just a place, it is what we all would get after we came out of the hospital, but we would be in our homes. And then we would get transportation to our follow-up appointments. And maybe a nurse would come visit. I tried that with my 85-year-old dad who just had heart surgery, and they told me that there's no chance in hell I was going to get that with, I won't name which MCO it was, but with Medicare, they weren't going to come visit him, so I had to be an advocate for my dad and fight a little bit. But, we might have an OT come into the home and take a look at it and set it up if we need some sort of support in the shower or whatever. Like, this is just a place because people don't have it. So that's the level of care, but it's a new thing. It doesn't fit any of the sort of existing conventional models. And there are now hundreds in different forms around the country. Most of those are dedicated shelter beds with visiting providers. There are a few like this where, like, it's the whole thing. It's the whole thing. Does that answer the question?
Yes.
So, there are things about meds, there are things about, if you can manage your own oxygen, if you can, but there are certain, if you have certain clinical needs, we're not suited or staffed. Or probably at some point we would need to be licensed. Medical respite is not licensed. Shelters are not licensed in the state of New Mexico. So this is just a living situation. It's not transitional housing really. It's sort of a step up from a shelter, but it's a place to live so you can recuperate.
So Robert's team is there 24 hours a day, making sure that all the needs of the residents are taken care of if they do have a medical emergency. But Ginny's team and First Nations are not there 24 hours a day, so they do, what would you call it, visiting office hours?
Yeah, the clinical teams do what we would call probably rounding, as needed to stay in touch with their patients, but then, the community health workers, if there are appointments or referrals or helping someone with Medicaid and we're working out the distinctions like whose team does what as well, because we want to optimize. We want to have everybody working at top of their training and really clarify those roles so that the people in medical respite get more. We're not duplicating around them, so there's a lot of, I hear you guys are case staffing and really sitting down and really talking to, okay, who can do what for them. So if, for example, you all were supporting someone, it's always person-centered care, and decided that the person saying, I just need to talk to someone, I'm feeling really anxious, then we could, on any given day, call our behavioral health team, and they could send a therapist over, or a psych nurse practitioner from our team. So they wouldn't just be here waiting for that to happen, but we can pull, and that's the way healthcare, our organization does. We go out to the west side, to the shelter, we're up and down Central, we're in the foothills, we're in the Bosque, wherever there are people in Bernalillo County, our teams are out every single day, and we might have medical, dental, we can do dental on the field, it's very exciting, they can do dentures. They told me they're going to start doing extractions, I'm not sure how that's going to work. Because I always say there's we can do PAPs in the field, in our vans, we can take all of our care out, and we do it in integrated teams, but if at any given time, we're at this outreach on Friday nights at East Central, we're up by the library, if we're seeing more and more people with this need, then we might pull in our diabetes educator, or we might pull in our pharmacist to do vaccines. So we can be really, really nimble in the teams we pull together. So that's the level of care. It's more like visiting someone in their home, and not watching them 24/7. It's not, which wouldn't be a good use of clinical resources.
Can I jump in?
Yeah.
I like to contribute at a level, I like to get to you next, okay? But just to contribute from my own perspective as a part of the team and coming into the department with this building understanding about all the components and how we contribute together, how I would describe this work is impactful. And it's that you compare it to the availability of care that was there before. So for a new beast that is tackling an issue in an area that people weren't being caught before, there's around a dozen people that are really having a real life impact on their pathway to a more stable situation. And so when things feel uncertain, I just went to a workshop this week about facing uncertainty, right? And you just really need to value the different inputs and the real impact that things have. So as optimistic as I have to be as a community volunteer engagement person, I really want to have that level of realism that these real people's real lives are better because these services are here. And so, whatever uncertainty we're facing with funding, whatever uncertainty, if we wish we had 100 service centers, the fact is that when this opened up and we accepted the first 2 people, that was impactful from day one. So just to contribute my 2 cents, hi everyone. Hope you're all doing well. So on to the next one, because I just felt like it was worth
Am I the next
highlighting
person?
that.
Just I
Yes.
am, okay. We talk about everybody is eligible for a voucher when they are discharged, when they leave the, this interim facility, right?
If they're eligible for this program, yes, when they leave it, they're eligible for those vouchers.
And I'm a little uncertain, what kind of housing does the voucher allow you to have?
This is permanent housing voucher.
Permanent housing, so that would be like an apartment with a kitchen and a bathroom?
It would, for an individual, it would be like a housing subsidy to be able to get into a rental. It would be rental.
Purchasing, not
A rental.
Oh, a rental.
Yeah, it would be a rental.
So it's not just a motel room?
No. When I say housing voucher, I mean housing, because motels are not housing. Shelters are not housing, and I know we all use different terms about that sometimes. So glad that Gateway West is Gateway West and not any longer. And this is where we work really well with the city because sometimes we disagree. It's not an emergency housing center.
Is it like Section 8?
It would be sort of like a Section 8.
But it's locally funded, right?
But it's locally funded, so it's a lot more flexible than Section 8, which was the beauty of what the city agreed to do. So we need to, all the partners, that's why we're doing evaluation, because these guys fight for every one of those dollars to be allocated to these kinds of programs, and so we need to demonstrate we're being good stewards of those resources.
Does anyone follow these folks to see how they're doing once they're placed in a home?
So everyone who is in medical respite right now will be seen either by Albuquerque Healthcare for the Homeless providers teams. And provider teams, when I say it's not just clinical, but it's our housing navigators or all our social services, or First Nation. So what we do, both of our organizations, when someone gets housed, we can follow them and support them. And we do usually from a housing first model, meaning it's also about making sure that people are good tenants.
Yeah.
So they can keep their housing and that they get the services and the care that they want and need to be able to maintain housing, to be able to live quality life. As healthcare providers, the one thing we don't want to do, and we'll have to work some of this out too, we'll provide care if you, regardless of ability to pay, if you are experiencing homelessness, my organization will provide care. We have capacity issues, healthcare does, but we work on access. If someone already has Medicaid and they're established with a primary care provider at PRES or UNM, and they happen to have an acute moment or an accident or something, and they land in the shelter or they come into our services or end up in medical respite, it is not in our interest from a person-centered model of care to not work with their established primary care provider if that's working for them and their established pharmacist. We don't want to go provide care to people just so we can say, oh, there's one more we got. Like, that's not what we're about. Because we want to help them maintain that relationship. If they already have those, what we call portable resources. So if you have a housing voucher, it follows the person. It's not a housing voucher to go to this address to use for this apartment. It follows the person, the choice. If you have Medicare, you choose your primary care provider. So that's portable in the sense it follows the person. And we don't want to disrupt that because that's what we're working toward, is making sure that people have those community resources that can help them stay housed, healthy, engaged in community, whatever that means for them. So we will follow them. However, if they're already established with case managers or a primary care provider or a dentist, we're gonna try to reconnect them to that. This is, not let whatever's happening to them in an acute sense right now disrupt that continuity, because that's what's gonna make a difference for them in their homelessness.
I know there might be some challenges with volunteering, but are there volunteer opportunities out there for the organization?
For our organization or for medical respite, or either?
Either.
Yeah, I don't know about medical respite yet.
Well, I'll defer to Alon for that.
Hey, I was waiting
And
for
then
an
where-
introduction.
Where would you go?
So for medical respite,
Do you want to introduce yourself?
Hi, everyone. Sorry, some of y'all getting sick of this. My name is Elon. I'm the Homeless Public Outreach and Volunteer Coordinator for our Department of Health, Housing, and Homelessness. I'm uniquely positioned and prepared to accept community input in the form of donating your time. Resources are also in demand, so if you have an extra pair of pants in your closet you want to bring on in, grab a buy one, get one packet of underwear. We are routing those resources, including teams of volunteers to help us keep those donations organized to get them to the most appropriate program and shelter. Today I am coming sunburned and just covered in dust from a community resource fair that we had at Gateway West. So there are residents there where our wonderful, wonderful community partners, nonprofit organizations, other city departments, just supportive people show up for them and show that they care. And so we are running off of a public website called 180Q Volunteers. That is citywide for other departments, but I promise they're not as cool as me. Don't tell them I said that. But,
Our needs are higher.
yeah, we really, really, really try to keep our engagements effective and useful. And we're meeting people with the skills, talents, and abilities you have to share as well. And we're trying to put that into best use. And so if you have a group, if you have an itchy burning question I'm going to get to, but yeah, really, at any one of those levels, we're really looking for that service-minded attitude, for if you're in a place that you can give, and that's, within your bandwidth. We have an Amazon wish list right now, so I'm really trying to make it easy for everyone. So really, on any of those levels, even at the highest level, if you're maybe a faith-based organization, you have a piece of land, and you're willing to work with us to see and explore what safe outdoor space might look like. So there's different levels of commitment, different levels of responsibility. I think that we're all assuming too, and so if that's kind of in the cards for you, if you check out our public website, or if you have a new idea, a way to serve and connect with people that would be really impactful, that's what I'm all about. That's what I'm here for. So.
Yeah, so we have our volunteer opportunities range from help us build beds as we were doing renovations and bringing new sites online, to we are looking at building our engagement center here. I'm looking for retired or not retired home ec teachers who would be willing to teach about grocery budgeting and how to do proper cleaning of a house or an apartment once you get one. So if you know of anyone that you can send my way, some basic cooking, self-sustaining skills like those. So we have a whole bunch of opportunities. So if you have something specific you want to come to us with our group, we have a lot of training, professional development, team building groups that come to us to spend a couple hours or a day with us as well. So thank you for that question.
Great, well, thank you.
I
That's
promise
a
I
great
didn't
question.
plan that question.
oh no, yeah, I mean, we take volunteers, but if people can do all that, that's great.
I mean, serving, we do holiday meals at Women's, and now that we have respite, we'll be looking for volunteers to do serve holiday meals. We try to do stuff around everything from Valentine's Day tea to, we have not talked about Easter yet, but
Spring,
Fourth of July.
You have a lot more opportunities.
That's what it is. So yeah, we're in touch with, sorry, Mike. You first.
Me first?
Yes, you.
I just wanted to say yes, if you go to the website and you register, you'll get a weekly email saying what the opportunities are.
thank you, Mike. I promise I didn't plan mine either.
We are working with our managers at each of our shelters and operators to really temper our approach to make sure that the services that we're bringing is applicable. We came out of a bingo night this past week. We get lucky sponsorships of people that care and add that extra cherry on top. At the community resource fair, I wasn't expecting it, but the operators at Chicanas Guanacaza, they also contributed gift cards for a raffle. And so really, all of these different valuable relationships and just seeing where they lead to, we're exploring that with our management teams and making sure our approach is as sharp as it can be, because it matters.
just to jump on there, Elon, we had a video game event Saturday afternoon a few weeks ago. Elon came with a video headset. We had 65-year-old ladies doing virtual reality for the first time. It was fantastic. And then Elon came on, gave his Saturday night to join us. We had 22 of the 50 ladies participate in bingo. It was a good time. I figured it would be fun, but it was next level. So Elon talks a lot, but he shows up and he does it. So we appreciate that. The ladies laugh and they're like, when is he coming back? I'll be there too. She says, no, we want him. So we appreciate it very much. So thank you.
So Robert, I'm going to turn it over to you to give your update.
That was the exciting part of the update, was the bingo and the video games. For those, you should all have their sheets here. I'll go over some of the numbers. It was nice to see the success that we look for is permanent housing. We had 5 clients who went to permanent housing, and none of those were with subsidies. So that means self-pay, and that's exciting because that means someone's working, and that usually means they're taken off, needing Medicaid and food stamps and so forth. They're self-sufficient, which is, housing is one goal, but self-sufficient housing is that next step. Something that I found interesting, those who can think back 6-7 weeks ago, we had some beautiful weather at the beginning of last month, 70 degrees, I was out in shorts and a t-shirt. If you look at the numbers, last year was a leap year, 29 days, we had 33 exits. We had 45 exits last month. And the bulk of that, and I hate to say it this way, but good weather leads to bad decisions. And the person who, it's 45 degrees out, I'm willing to not be able to, and I'll just put it this way, use my fentanyl or my vodka or whatever, on my terms, when it's 75 degrees out, it becomes a lot easier to sleep outside. So you can see the number. I was kind of shocked when I did those numbers. I've got the ages here. That 18 to 24, it hurts to see. No one deserves to be homeless, but it's beginning at that young a level, at an age. You just hope that they can see it. And my hope, when they see a 50-year-old, a 60-year-old, a 70-year-old, especially whether it's substance use or alcohol, and maybe, and excuse my language, but should scare the hell out of them. Like, that could be me in 40 years. Maybe I can change. We see it. We did have not this client, but 6 months ago, a 22-year-old, and she was doing things she shouldn't, and one day it clicked. And she just got clean. She did it herself, but she will use our case managers. She got a voucher, got permanent housing. And some of them will keep in touch with our case managers. She's doing fantastically. That's a life turned around. Sometimes fear is a good motivator. So I hope the younger ones can look at the older ones and say, no, that's not for me. That's not the life I want to lead. So hopefully, I want everyone housed, but especially to see someone so young is tough. And if you look at the length of time that people were homeless before coming to us, I mean, some of these 5+ years, 10+ years, that's a long time. Can we help those people? Can we fix that? Sometimes you can. And this shelter, the difference between our shelter and some of the others is the case management aspect. You could, you go to something like Gateway West and it might be 500, 600 people. You cannot, at least at this time, and I certainly wish the love to the case management, you cannot give case management to everyone. And with a smaller number, whether it's something like medical, it does now up to 50 or 50, you can devote the time. You've got 4 case managers. There's a case out of 12 to 13 people. The amount of time you can put to each client will change lives. So those people, we don't give up on them. It's not just, hey, you've only been homeless 6 months, let's make sure there's no more homelessness. Everyone that is willing to engage. I want to make that clear. We give them 30 days initially to stay with us. If you're engaging with case management with a goal of being permanent housing, you can be extended up to 90 days. But it's up to them to engage. We will tell them when the appointment is, they have to show up. We will work on an ISP, an individual support plan, but they have to go to Healthcare for the Homeless to get the voucher, to get an ID. They have to go to the MVD to get their license. They have to fill in job applications. It's a 50-50 partnership. So I really want to make that clear, that case management is the biggest aspect of staying here. Everyone deserves a shelter, but our shelter, why it's called the Gateway Housing Navigation Center, is because housing is that end goal. So any questions on anything that I have? Yes.
Sorry, I missed lots of questions. On this sheet, you've got 44 new people, and that down at the bottom, you said 57 accepted. What's the difference between those two numbers?
The 13 never arrived to complete
No.
their intake.
No,
Yeah, so
57 were
57
accepted, but 44 were new intakes.
57, yeah, so it says 57 were accepted, 13 of those never arrived to complete
Oh,
the
I
intake.
see. Okay,
57 minus 13 is
13,
44, yeah.
Okay.
So
I
we'll,
thought that was a separate category.
yeah, no, we'll call someone at 9 a.m., say, Jane Doe, we'll go over the qualifying questions, we have a bed for you, be here by 7. Oh, of course. They just don't show up.
Got it.
So the next day we fill that bed again. Any other questions?
Yeah, I actually have one. The 65 plus age group, it says 10, right? In January, so from January to February, was that number up or down?
Similar. I can't tell you, I can get those, if you want next time, if those
Oh,
kind
no,
of
I mean,
numbers.
I probably have my paper at home, but I was just curious if,
Yeah.
because I know that you were talking about increasing the, I can't, anyway, for the elderly. And I'm just wondering if there's more elderly on the street now than there was in January.
I just from an anecdotal standpoint, and I'm not doing the intakes anymore, but I kept getting more and more calls from people saying I've got a 70-year-old, a 75-year-old, and this or that evicted for something like this, or lost, husband died and, can't do it anymore. So I don't have numbers to back it up at this time, but yeah, to me it seems like that's the fastest growing population is the elderly.
It's growing in our patient census and also nationally. And we will have, we've been consolidating and doing interviews and desk research, and we're just working on that paper right now this week, so I can send that out, but it's definitely trending up. I think the other thing on here that's interesting is the length of homelessness. I'm wondering if some of that is beginning to shift a little bit too, and I don't know if they're related. So it's always very interesting to look at, because then our response is based on our understanding of these demographic data, right? So how do we design the response? But definitely, and we're also saying, look at aging, and you'll see this when we send our report out. Because life expectancy is 20 to 30 years less than the general population for people who experience homelessness, we're looking at 50 and up. And I think if you look at the shelter on the west side too, on Gateway West, there are a lot of people that are 50 and up, and their conditions are those of someone 60. So we're moving away from even 65 and up. I know that's the way the federal government tracks it, but really, like, what do we need? What do we miss? Where's a gap between age 50 and age 65? Because 65 is, I don't get any discounts yet. I keep paying my AARP membership, but there's, there are people in the meantime that are having the same experiences, the same health conditions, the same progressive dementia, and all the same struggles, but we're not even providing health care to them in the same way. But their aging is actually, it's not chronological. So we're really looking at that gap in between. I think it's really important.
If you look at over 45, between 45 and 65 and up, that's 66% of that, all of those people that, and to your point, to the 33% of them experiencing 1 to 5 years of homelessness.
Any other questions? Thank you.
What does undisclosed mean?
She wouldn't give us her age.
Oh,
This was one specific client,
no, that's fine.
yeah, she wouldn't give it, she gave us her initials and didn't want to get, over time she told us everything. But initially she was dealing with some schizophrenia and didn't want to share anything. I said, that's okay. You're asking the question once, you don't want to share, I'm not gonna hassle you for it. She told us everything within a week, but yeah.
Okay, any other questions for Robert? Thank you, Robert. Laura, did you have anything you wanted to report out on? I don't mean to put you on the spot, but I don't want to end the meeting without checking in with you. Is there anything that?
Specific, you have anything?
No, I would say mainly what the Albuquerque Police Department is kind of direction we've gone is just a zero tolerance if you're breaking the law, you're gonna be cited or arrested. It doesn't matter if you're unsheltered or, you know, make money and a job like that. It's just we have to go to a zero tolerance because the streets have gotten out of control in the last couple of years. Hopefully it's showing.
Does that include drug use? I heard the mayor talk earlier this week, and he said we're gonna arrest you if you're selling drugs. Does that mean that they get a pass for just using?
No, absolutely. Absolutely. And I think, I mean, if you've seen the difference, Central Avenue, you know, there was people just openly smoking pipes with drugs and stuff. And it's like even in a fully marked police car, they were oblivious to even care because our department shifted over the years to a place where officers weren't enforcing stuff like that, whereas now we are. So I hope it's making a difference.
So you arrest them?
Arrest or cite, it depends on the circumstances. Yes, ma'am.
I had heard there was a report, 126 arrests or something, the first month. I was wondering if you had an update on that?
In regards to?
The Route 66
We're
performance.
running an ongoing plan, and it's actually from like Tramway all the way out to 86th Street.
Right.
Those numbers fluctuate. I don't have the.
So you don't have a choice. It was on the news, I think.
And the Route 66 that's being run out of the DA's office, so
Yes.
we have those numbers.
You do have those numbers?
No, the DA's office.
Oh, the DA.
Yeah, they're the
Okay.
ones that are tracking those.
Okay. Thank you.
Yes, sir.
I don't know who would be in charge of this, but just driving from here, let's say San Mateo to Eubank, I just see so much trash. And is there, I mean, I don't know whether homeless people just don't want to put things in trash cans or if there's not enough trash cans. Is there any plan to reduce the trash on Central Avenue and around Central Avenue?
So every day we have a problem response team. We actually have two running right now. One works during the daytime, one works at night. They work hand in hand with our trash. They drive around. Our solid waste has a specific truck. You'll see them. They drive around. There's like 2 or 3 like normal pickup trucks, and then it's like a miniature garbage truck. And they go through and they're cleaning the streets and the alleys. I will tell you, just based on my own experience, if we clean up trash and I go maybe somewhere else in the area command, I come back, for whatever reasons, it is accumulated back, and we cannot, I don't have the answer to that, but we are, every day, solid waste is out, picking it up, filling, and they're loading these garbage trucks out.
Don't we have a trash littering ordinance in the city?
We do. I think some of the citations that are being issued now are mainly for like blocking the sidewalk, which we see we can't walk on our sidewalks. Most of our streets are partially blocked with encampments overflowing onto them and stuff like that. So
I'm talking about the trash also.
yeah, I mean
Yeah, okay.
littering, but I mean it's a petty misdemeanor, and
Well, it's a big problem.
we could write tickets all day,
Yeah.
and then once it gets to the judicial side of the house, it's a laughing, yeah, it's like getting a parking ticket. Who pays their parking tickets? Nobody, so.
I have
Who
called
enforces it?
311 more than once for trash, and they've come out and cleaned it up pretty quickly.
They do really good,
Yeah, they did when I called.
and we're actually running it's a temporary position. There's 5 officers and a supervisor attached to it, and they're actually citywide, but it's an encampment team, and they're going out, they're providing resources with ACS. And then they're also, you know, like I said, the zero tolerance comes into play. I think a lot of the unsheltered that choose to live on the streets, they don't want the services that this building can provide because it requires you to not use the substances that you're addicted to. So that's kind of where the city has gone to that type of approach. That answers the question.
And who would I contact to ask for more trash cans?
Your best bet would be the 311 through the telephone, and then there's the app on your phone. You can also download for 311 and report trash or graffiti or anything like that, and they just send out crews to pick it up.
On this graph here, the one that's got the lines, the following page has 3 of the 5 categories described. Shot spotters not, but that's obvious, that doesn't require description. But what sort of calls are proactive calls? I noticed that line is jumped more than anything else.
Yeah, proactive is basically not being dispatched. Like if you were to call the police, that would be a call for service. If I'm leaving here and I drive and I see something and I call out on the road and say I'm going to be out with this or do a car stop or anything like that, that's an on-site activity. And I think kind of going back to what I was talking about earlier, we have transitioned back to actually doing good police work, and I think it's being pushed to be proactive. Our officers aren't just responsive anymore.
Just a question on number 18 on the quality of life. The DE escort violation, is that a violation of the construction law?
It could be, or it could be an officer releasing stand by and also
Oh, okay, okay, escort.
So, but it could, it's
Let's chime in on one of the points that was brought up from a totally different perspective, right? When I see trash in the streets and I remind myself, like, oh, these are my streets. Like, I live here. This is my community too. Across departments, focusing on our areas of intent and purpose, I've organized community cleanups, and there are really awesome programs with the city. They provide trash grabbers, they provide bags, they provide hand sanitizer, sunscreen if it's the right time of year. They really equip us well. And that was available to me as a volunteer program coordinator. But what they let me know is that it's a public resource. If you have a community or an area of town that you feel passionate about organizing and getting equipped to address those kinds of issues, there is a Albuquerque Beautiful program. It's through us on this department. They'll bring out that mini truck to you. And if you just let them know where you're going to be compiling whatever you pick up, they'll pick it up for you. It's not a charge. The equipment is there for you. Again, there's gloves, grabbers. There's really a way to activate other inputs and components here that don't depend so heavily on stuff that we're waiting for. So if we really are intentional and proactive in our own community response to these issues, I think that we could be in a better place. A lot of the time, it's the special events that get the attention, right? So the Balloon Fiesta, they have like a huge Fiesta Fanatics push for that. So different parts of town are kind of activated at different times. Also for us as a department, like I would be super excited to organize a community cleanup for us here to make sure that our areas that we're operating in feel comfortable, safe, and good. So community cleanups are there. It's not just for our organizations, but it's also for the community to take charge of some of those things too. So you can get equipped and empowered by all the resources we have available to us.
I was going to say that I did one of those. I'm also working with homeless people, and it's amazing how many of them complain about the people who create trash and whatever. But I go out on average 2.5 times a week with homeless people, and we pick up trash.
You put it in bags?
Yeah.
Yeah.
I've got one woman who's been using the grabber and picking up needles. She wants to start a nonprofit. She's homeless, but she's got a business management degree. She wants to start a nonprofit organization to get homeless people to do that and get some reward for that too. We pick up a lot of recyclable metal, and that's how I encourage them to join me in that. Is whatever we pick up, they get paid for it, plus a little bit out of my pocket. So there's lots of opportunities to not only work with your neighborhood associations, your neighbors, etc., but create relationships with the folks who are living on the streets. Because they want to see a better environment for everybody.
I'll just announce that April 12th for Parkland Hills, we're doing our neighborhood.
Thank you.
Perfect segue.
Yeah, I think that's for the city, right? 'Cause
Yeah,
Albuquerque
that
is
is
doing ours as
one of
well.
the official days,
Yeah.
the neighborhoods.
Okay. That's Earth Day, it's April 12th Earth Day.
No. It's an Earth Day related
27th.
thing, but yeah, it's not necessarily the Earth Day, yeah. I mean, every day should be Earth Day, right?
Did you say April 12th?
April 12th, it's a designated, sort of community cleanup that the solid waste department is, sort of putting out the sign up by April 4th to be involved in that program for April 12th.
Are they helping by picking up the trash or everything? Solid waste?
Yeah, they can do it.
They come and get it, yeah, after people collect it.
Yeah. You get it, we'll take it.
Right.
Okay, we're about ready to wrap up. I wanted to see if you had any suggestions on guest speakers or topics you would like to hear about at our April meeting. Any burning topics that you really want to know
I'm
about?
kind of curious about the finances. Like how much it's costing to run the gateway, how much the gateway's making from the rentals within the building, that kind of stuff.
I'm not texting, I'm taking notes.
Oh, sure. Okay, what game are you playing?
Is Angry Birds still a thing? I don't know. Okay. Okay, anyone else? Yes.
Code enforcement, because we've been noticing, as we do our walks for the walking school bus and safe routes to school, unfortunately, when people are leaving apartments or houses, they leave their big item furniture and big ticket items on the street. And then in our area, although we had a couple of houses set on fire that are boarded up now with the yellow tag, but unfortunately they're still attracting said individuals. And so now, I believe now that warmer days are coming, it's gonna be a little bit more intense. And so I know code enforcement, since I've known them, have been understaffed. And so it's kind of hard for them, obviously, to get everything, but it would be great if they could come in and give us, like, if they have a summer plan, or if they,
Yeah, summer plan, because we're seeing people that leave their furniture and their mattresses on the side for solid waste to come, and then houses are using them, and sometimes they set them on fire. And a lot of fires are getting started in the neighborhoods because of it.
Her name's wrapping up.
Jennifer, I'm still interested in what's going on with Central. It just seems like there's so many businesses closing.
Yes.
I'm wondering if it's like a realtor's movito, or however you say it, to just get that property down to rock bottom price, and then somebody's gonna come in and do a big development. It just seems ridiculous. I mean, Advance Auto closing all their stores around here, and then Walgreens, and just so many.
It's not getting
South
better.
San Mateo also. I heard the
San
late
Mateo.
mayor tell us, oh, no, we're getting more businesses opening than closing, and in this neighborhood we're not.
You know, I drove down Central today and it was horrible. Horrible. You know, buildings had burned that I was unaware of. They weren't even there anymore, and the homeless were everywhere. Walking in front of the cars, you know, as you're trying to drive, you walk in front of the cars and I don't know.
It's weird. It's weird.
Anyway.
Jennifer?
Yes.
municipal development funding is available, and it's usually for a specific area of town where extra money is put in. I've inquired with Terry Bruder, who's directing that program, and asked if he could do something to enhance the South San Mateo municipal development area. Of course, the answer is always yes, but I haven't really seen that happen. I'm gonna do a follow-up on it. The other thing I wanted to let folks know is that Senate Bill 481 is the state TID funding for the fairgrounds. So they have their money, and it has a potential to be a lot. An estimate that's kicked around to totally rebuild and redevelop fairgrounds is between $500 million and $1 billion. And this won't happen tomorrow, of course. But the good thing about the state TID is that those monies can be extended to a reasonable degree to surrounding communities. So I'm working with Mayor Chavez to see if we can acquire money for Catherine San Mateo, which has been a promise made for a long, long time. I've also mentioned South San Mateo. It's really it's one area. So we're really hoping that we may see some movement. There's a lot of politics for that, and a lot of building of relationships, to try to get some of these things done. But it's overwhelming. With trash pickup, my neighborhood, streets are pretty clean. We had wind, trash cans went everywhere. I went in the house to get a plastic bag to pick it up. Neighbors are already out. Okay. And it was done. You go east of San Mateo, there's, like Lieutenant said, clean up a block, you come back, and it looks like nothing has happened on that block. And we've got to break that cycle. We've got to build, it's not only a sense of community, but we have to improve the area economically. As developed communities have less crime, less homelessness, less problems. Just across the board. And that's what we're trying to do with East Central and the ID, to provide hope for a mom when she looks out her kitchen window so she can see a better day. She doesn't see that now. It's the same old day, the same old crime. And I want to compliment the Lieutenant and the Southeast Area Command. They are doing a fabulous job, I'm telling you. And East Central has changed to the positive. I drive that area a lot, and it's noticeably better. But as I came here tonight, I counted 9 encampments in the public safety zone around Gibson. And we've just got to be a little bit more attentive. And Lieutenant, this is a city community agreement where the city said this area will receive a little extra attention, and we do get it. And after the meeting, I'm going to ask if I can talk with you, see if we can get a little more. It's right around the ACS building. And I have deep feelings for these folks. Some of them I've gotten to know in terms of being familiar, or there they are again, or there she is again. And some are noticeably out of their mind, or they have some serious, perhaps drug-induced problems. They need help or mental health issues, and I think we can and should do better. But we've got to balance it with property owners as well, and retired folks, and people who go to Wilson Park and turn around because they see things in Wilson Park they don't want their kids or grandkids to see. And, you know, I mean, it's, we gotta strike that balance somehow. I think we're moving in the right direction, so I'm hoping that if we should get an influx of money, and here we are talking about influx of money, when our president is saying we must reduce the federal budget by at least 15% across the board. And you know, it's a serious matter we're going to have to cope with. But I think we can do it. This is a wonderful town. This is a strong town. This community is so outstanding. I sure appreciate all of it.
Peter, if I may,
Yes, you may.
I think Nicole had one of her participatory budgeting projects is for the Catherine and San Mateo area garden center or something like that. Have you?
Yeah, I know a little bit about that. That's somewhat controversial. Well, first of all, there's 10 years of information from community meetings that the city lost. They can't find it. And I know Sandra and I have attended, I don't know how many, together. Notes were taken and we put the little stickies up and all that is gone. And you know, you gotta laugh. On the other hand, it's, you know, it's a kind of a serious thing. So the last time we talked about Catherine San Mateo, they said, well, we're gonna get the community together and we're gonna plan together. The community said, no, thank you, we've already done that a lot. So besides that garden center, a multi-generational center with a significant behavioral health program is being proposed for that area. That would make a lot of sense.
I'd like that.
You know, our young people are finding guns, and it's very easy. I'm sure everybody in the room, I mean, we could go probably out the door, and within a half an hour, we could buy the gun of our choice through various means. And I always say, what do you want in the hands of a child, a gun or a basketball? Well, I would advocate for the basketball. So if we had a multi-generational center, 24/7 under supervision, seniors, families, children could be in the same place. And I'm an educator here to tell you that when children have a choice between unsafe and safe, they're going to pick safe. Nearly 10 out of 10 times, because they know what safe is all about. So there's at least two ideas. Another idea was mixed use, some apartments, some locally owned business sites, not a huge corporation type of thing. So that's kind of where we are now.
Bring back Rusty's.
Yeah.
We have one more person to share. We're coming to the end of our time. If it's really pressing, we can keep it condensed for each other. Just go ahead and make time
Just
for
real
each other.
quick, Jennifer, and, you know, we want to be good neighbors. We have an air show coming up, if you haven't heard. End of May, beginning of June. If you want more information to see how maybe your communities will be impacted those 2 days with some more bus traffic, etc., please just get a hold of Eva, and we'll be more willing to provide that information.
Okay, great, thank you.
And so, no, I just wanted to, a positive thing, if you're not doing anything on Sunday, from 10 to 2, we're having Bernalillo County is having a pop-up event in my alleyway. We're part of the alleyway reactivation program that the neighbors have started. And it's also part of the Safe Routes to School. We're trying to activate neighbor alleyways so kids have a safe place to walk, and neighbors too as well. And so this is gonna entail the 800, 700, and 600 blocks of California. So the pop-up is gonna be at the 800 California, which is Catherine, California. And so it's Sunday from 10 to 2. Bernalillo County will be there with everything, and they're gonna be walking tours through the different alleyways that we've stuck in. So that's positive.
Great. And that's a result of Miss Sandra and Miss Natalie and others that have really done a good thing. I think they deserve a big hand on the alleyway project.
last announcements, Saturday, ACS is having a celebration, in the afternoon, and then, the participatory budgeting is going to have their kickoff, the voting is going to open, and that's Saturday afternoon, I think 2 o'clock at the,
1 to 3?
1 to 3 or
2 to 5?
something,
2 to 5 at the library.
yeah, at the International Library.
Thank you. Hey,
So
thank you,
everybody
everyone.
votes on that?
Thank you.
Everybody votes, you want everybody to vote, yes, that is the goal, we want everybody to vote.
A big hand for our guest speaker, Ms. Jenny.
Yay!